It's really nice to have the opportunity to talk to you about something that's really important. Janice, we both work for Kinship, the organisation, don't we? And we're going to hear your experiences actually, and we're going to have a conversation and hear your journey through Kinship, which is a real privilege to be able to do that this morning. Really appreciate you for being here. But you've got a role within the organisation as well, which is a really important role. Did you want to say what that is?
Yeah, morning. I first and foremost, I'm a kinship carer. I've been a kinship carer for 10 years. And throughout my journey, I have worked with, it was previously Grandparents Plus, it's now Kinship. My role within Kinship, I'm a national peer support connector. So we work with group leaders in a hub, feel very privileged. We work across the organisation, bringing all the little threads together.
Kinship care is really a movement, and it's, would you say it's a movement of people?
Yeah, it really is, Tim. And what we found is through bringing all the group leaders together, the momentum that's picking up and the changes that they're making through education and everything is just unbelievable. It's absolutely amazing.
Wow. Well, there we go. A bit of context at the beginning, but let's have a look at these session aims, because this is what we wanted to bring you this morning, to give through a conversation and hearing Janice's story, and then giving you some of the national context. We've actually got hot off the press the results of our national survey that we do every year of kinship carers. So we'll be able to give you that hot off the press and live and direct a bit later on in the session. And this is really what we want to cover as far as the learning objectives go and our session aims. So we want to help you to understand the diversity of kinship arrangements, to explore how disability and kinship care interacts, and the complexity that can bring to family life, and to develop an awareness of all of that, the practical emotional supports that and what's out there for kinship carers, what makes a difference, what helps, and then thinking directly about practice, social work practice, and professionals working with kinship carers. You know, what can help, what's empowering, what are good ways of and good forms of language to work with kinship carers. And then I think at the end, having a bit more of an idea about, or developing your what you know about kinship care, because I know this is really the territory of your work and will have been for a good period of time for lots of you. So we're not starting from a baseline here, but building confidence in recognising kinship situations. Yeah. So Kinship, I mean, that's right, isn't it, Janice? The leading charity?
Oh, totally. Yeah.
Yeah. And I mean, if you search Kinship on Google, it will come up straight away. The big yellow, I like to think of it as the yellow sun or a spotlight spotlighting Kinship as an issue. And Kinship, the organisation, is a campaigning organisation. It's working on policy, it's influencing government, but also it's mobilising community as well, and scaffolding and supporting peer groups of kinship carers that can find people locally that have been there and have a common experience. And also it works on practice as well. And my role in Kinship, the organisation, is practice lead. So I'm working all the time with local authorities, social workers on kinship practice. So actually, as an organisation, it's working across multiple levels. Yeah. This is what we do, isn't it, Janice? Yeah.
This is it. This is it.
Yeah. So you can see, and one thing important to say for all of you, and the students that you're supporting in their different placements in local authorities, is there's lots of stuff that you can tell people about. You can tell kinship carers about, people in community. There's lots of free services and support that Kinship, the organisation, offer. So there's a case in point this week, isn't there, Janice? So Janice, you rolled off of a huge event in St James's Park on the Friday. And then was it Tuesday you were
in Leeds?
In Leeds? Yeah. What was happening in Leeds on Tuesday?
Oh, what wasn't happening in Leeds on Tuesday? We had fire alarms and floods, and we had somebody from Department of Education there. But yeah, first and foremost, we had a lot of kinship carers. Like I say, they're always hungry for the training, for the support, for the advice, and people who aren't aware of the charity. We had a couple walk through the door, Tim, and they were just overwhelmed by everything going on, and they were going through bereavement and everything. They'd lost a daughter, and from walking through the door, you know, we'd got them straight through to the advice line. So they're on the waiting list for advice. There was group leaders in the room. We found 2 peer support groups near them, so they're now introduced to 2 support group leaders. So they'll find the footing of where they want to be, or they can attend both of them. And it was just a total wraparound. And to get the training was just an absolute bonus while they were there. They walked away with their heads held high. It was a nice feeling.
That's brilliant. So those road shows are going on all around the country, and any kinship carer can come along to those, and no matter what their legal order is, or if they have a legal order or not. So that they're really important. And also there's training, online training and support, which is funded directly by the Department for Education, and that's also available as a universal offer to all kinship carers, so they can drop in and learn and get training alongside other kinship carers. There's something called Kinship Compass, which is where on our website where a kinship carer can search their local area for things that are happening in their local area. And Janice has referenced the peer groups where a kinship carer can come along and speak to others that are in the same situation as them. And that's really important for them, for their solidarity and talking to someone like them. And then we've got actually some services that work in local authorities. Some of you might be in local authorities where these services are operating. So we've got Kinship Connected and Kinship Reach. And so these are about actually having support workers working on one-to-one, working directly with kinship carers to help them navigate the services and the support that they need. So they're really excellent things. And there's some other things like our Kinship Care Guide, the annual survey that we're going to talk about later. So there's lots there.
Hot off the press, Tim.
Oh, there we go. Oh, brilliant. Yeah, there we are. There's the Kinship Care Guide. I think Kinship, the organisation we've mentioned already, is powered by lived experience. And I think our way of working is always to work with a mix of lived and learned experience. I think that's really important. So we're going to do that this morning. So it's by going into Janice's story, and she's going to talk about her experiences. But just to set the context, if you bob onto the next slide again. So we think, I mean, this is a conservative estimate apparently, but 141,000 children across England and Wales being raised in kinship care. And we want to think a little bit about disability and learning difference and educational needs on the call, I know, today. And so this is from our report, Forgotten, in 2024. And kinship carers told us that only 54% of kinship children reported to be getting the educational support they need. Nearly half of kinship children have a special educational need or disability. That's really disproportionately higher. And more than half of kinship carers said that their kinship children had mental health difficulties. And 1 in 4 kinship carers said that their child needed emotional therapeutic support. So we were really pleased when Nihal came to us and was really thinking about this session, which looks at kinship care, but it also looks at some of the experiences and the extra support that's needed. Janice, I mean, you mentioned 10 years.
10 years ago, my life changed.
Yeah, would you be able to take us back and rewind to that? To totally. 10 years ago. Yeah,
take you right back to the beginning. So I was an international transport manager and always kept a shift in at Asda from when my children were little. I'd had to have an emergency total hysterectomy at the end of July 2015, and I was on the sick from work, obviously. Beginning of September, we got a phone call. we'd always had my eldest grandchild all the time from 5 days old. We knew there was something. We were saying to professionals, you know, we're having like 6 nights a week and blah, blah. But no. Anyway, so we got a terrifying phone call from my daughter's partner saying that he was going to jump out of the window to save his life, that the boys had been taken hostage in the bedroom, and it was just a nightmare. At the time, me and my husband were just looking at booking a weekend away for my recovery. So yeah, my husband's a truck driver. Your instinct, we both jumped in the car 2 streets away. We get to the scene. My husband puts the boys in the car. They're then aged 1, just coming up for 1 and 2. Puts them in the car, takes them to my parents who are in the late 70s. And I was at the scene. My daughter had taken an overdose and everything else. We'd called an ambulance. Because of a history, the ambulance wouldn't come without the police. The police came. We were down the street. After half an hour, she was sectioned. To witness your daughter with 9 police officers on her back, with leg restraints, arm restraints, the whole shebang, and somebody holding her head by her hair was just horrifying. So she was thrown into the back of a police van and off she went to Suite 136. The boys were at my parents'. I was still waiting for my husband, who was back, and a police officer turned around and said, "Are the boys safe with you?" Obviously, yes. Wow, what a world that threw us into. So that
Janice,
happened.
just to acknowledge that what you've described there, that scene with your daughter and the police, I mean, that sounds really very, very difficult, very traumatic.
It was horrendous, absolutely horrendous. Bearing in mind, it had taken us like 15 minutes, my husband, to bang the door down to get the boys out. When we were up there, the scene was absolutely, the pair of them were high on cocaine or coming down from cocaine. We'll never know the answers, and mental health and everything. And she'd smashed a mirror and had it there. She'd cut herself all over, and the boys were just in shock, just screaming. So it was a scene I never thought I'd see in a movie, let alone my own life. So that in itself.
And your husband, I mean, really was able to move so quickly to protect
he knew he had to get the boys out. We had nobody else around us, so he knew he had to get the boys into the car. I had to stay at the scene for her safety, but I was so weak. You know, I couldn't push a hoover, I couldn't do anything, and couldn't run. It was just my daughter had taken an overdose and was going out into the street. I couldn't run after her. It was the worst feeling, the most helpless feeling. And I always remember this police officer coming past and in a car and said, "Have you seen?" I said, "Yeah, it's my daughter." I said, "But don't approach her until you've got backup, because when she gets like that, it's like an undue strength." I've been on the receiving end, and this strength is just unreal. So by the time I walked to the corner, the police officer had just ignored me and was actually, my daughter had her by her vest and flinging her over her head. So then it was a code 0, and every police officer, every police van, it was just horrendous, absolutely horrendous. And that was our start. So your instinct is she's still my daughter, you know?
Yes.
You want to know that she's safe. You need to know that she's getting the help that she needs, that the overdose isn't going to succeed. But likewise, the boys, my parents, I knew my parents would be in total shock to receive the 2 boys. My husband could get back to me. So that was just the start of it. Do
you mind me asking how old the boys were at that time then, Janice?
Just under 1 and 2.
Okay, wow, yeah.
And they were very, very familiar with us. Because we had them a lot, especially
you lived around the corner by the sound of it.
Just 2 streets away. But I will say the hardest part for me in reflection was my 12-year-old daughter used to go on the way back from school. So was my 12-year-old daughter used to come home all the time saying, "Can we bring the boys home? Can we bring the boys home? I need to bring the boys home." And She used to get told off because of pocket money. We used to say, you've got to stop buying sweets at the shop and that. And she was actually giving her pocket money over to them because obviously feeding their habit. And we didn't realise the severity of what the conditions, because we were always put off going to the house. It was always the boys ending up here. And I had 2 teenagers at home. I had one going through what turned out to be an ADHD diagnosis with impulsivity and hypersensitivity. So all that change all happening at once, you can imagine what it was like. So and I think repeating what Nihal said earlier about people that are affected by this, Janice, but I think it's important, isn't it, to these the traumatic beginnings of is common, isn't it, when you talk to kinship carers? They've experienced this, and and these experiences actually can shape or can reverberate, can't they, when as the children move into your care. And so being aware of it, being conscious and trying to seek therapeutic support and help is important, isn't it, as your totally we had nothing
forward.
Tim, we had nothing. So that happened just before lunchtime. At 8 o'clock at night, 7 o'clock, the police had called me over to the section 136 suite. And I'd had to go over there to take some medication. Came back, got the children from my parents, and this social worker rang while I was in the car, and he said, is that the grandparents of? And I said, yeah. And he said, are the boys with you? And I said, yes. He said, and are the boys okay staying with you? And I said, of course they are. And he said, where's your surname from? Oh, that's where I'm going from on holiday. That was it. And that was it for the next 48 hours. We were just left in limbo of what was happening.
Okay.
Bearing in mind, I'd had the hysterectomy. I wasn't allowed to hoover, yet I had a 1 and 2 year old that had been through a crisis. They didn't know what was happening. That it was just all so fast. It was unbelievable.
The next steps then, as you move forward, what happened after that, and what support did you get?
We got a social worker came round, and life was just upside down. We knew the youngest one wasn't right, and we couldn't pinpoint as to what. He was smaller, he was sick a lot, and everything else. And so we got a social worker, and the social worker had said that mum was allowed contact every single day and was allowed to take the boys out. And we were like, this can't be right. This can't be right. I was ringing the manager. She can't even get herself dressed. You've got neighbours ringing you in saying they're partying all night long. They're not knowing the boys aren't there. There's groups of people going round, and no, mum was still allowed access. But mum never made it for any of the accesses. But just the threat of it alone to me was enough that she had the right to come and take those children. I didn't know what shape she'd be in. I didn't know who was around the house. She had more rights than me because I couldn't go and check the house out to see who was there, what state it was in, or anything. Both the boys had different fathers. One who she was living with at the time was allowed access. So I was like, I can't drive, I can't do. She said, it's okay, we'll arrange the access at your house. So she arranged the access. So once my daughter heard that the dad was coming, they met at the house. That was the first time the police were called. Within 10 days, the police were called 3 times to separate the parents. So I got the social workers. Yeah. So, and you were managing all that. So again, maybe a discussion point for us, as social workers, supervising social workers on the call is family time, and I know that's and how that's managed, and what you have to hold, Janice, that's that you've got this. You're wearing many hats, aren't you, as a kinship carer? Because you're a grandparent, you become the primary carer, and you're also then managing the relationship around the family time and the contacts, and it was everywhere,
complex.
Tim. It's all the little aspects. So was never taken into consideration that my husband, where he worked, one of the managers was the person who was Logan's father, the youngest one's father.
Oh,
So
golly.
all this battle
Wow.
was going on, but my
Yeah.
husband was having to walk into work, and he
Yes.
was one of the managers. There was my parents, who couldn't talk to me without crying because they couldn't get their head around the situation. You know, it's their granddaughter, great grandchildren. All this time, my anger was growing. So I started, and I was getting stronger. If you remember, I said my son was going through diagnosis for ADHD. At the time, this was pre-COVID, 10 years ago. They had community mental health nurses, and it was actually her coming into the home who got props involved. That's like a families affected by drug and alcohol charity. I went to the doctors because I couldn't believe the health visitor hadn't been in touch. I went to the doctors and I stood in the doctors and demanded to see the health visitor when I knew the clinic was on without the boys, while my husband had the boys. And she nearly collapsed when she knew there was 2 children in need in the community and nobody had informed her at all. So,
and Janice, that those experiences and those additional needs that those your grandchildren, the children that you're in your care have. Do you want to talk a bit more about that, and maybe what you think, and maybe relate it to your experience of talking to other kinship carers, because it's very common, isn't it, as we saw in the statistics? Yeah,
totally. So we hadn't realised, it was through the health visitor, we hadn't realised that the boys hadn't, well, especially Logan, hadn't been attending appointments made for him at the hospital. He was a very poorly child. We didn't get an hour's sleep at all and didn't realise the severity of how poorly he was. So then we were up and down to the hospital nearly every day, seeing consultants and appointments and everything, and all these diagnoses were coming one after the other. He was hospitalised, and and it turned out, and still to this day, he's under 5 consultants at the hospital 10 years later because of his health conditions. And that takes up an enormous amount of time, of organisation, of absolutely everything. And it is hard going because every aspect of his life, but there's no help, no consideration. You're focused on keeping the boys safe, on what orders what, on this orders that. And we were told we had to go and pay for court, and just because at one point they thought he had appendicitis, the pain was so bad, and we were in the hospital, and the nurse had said to us, Tim, you need to get hold of one of the parents to give parental responsibility because he might have to go to surgery to have his appendix out. Saturday night, you can imagine, alcohol, drugs, the whole lot. Couldn't get anybody. I was panicking, sweating. And then a consultant came in and he said to me, look, we can override this. My signature is more than any parent's signature. If he needs this surgery, we'll go down for it. So, yeah, it's all the aspects of his medical needs. It's hard. It's really hard.
And do you want to touch on the legal order as well, and the complexity around legal orders and support?
We got the child arrangements order, and I did ask for an SGO after speaking to the group. And I have to go back a little bit, Tim. So when Props, the mental health nurse, had introduced us to Props, they told us to go to a peer support group. And we went to the peer support group, and my husband, Portuguese, workaholic, strong trucker, he's like, I'm not going. And the woman from Props said, look, just go to supporter this once through the door. Right. So we went to this group none of us wanted to go to. Actually, to hear other people were in that situation, we thought we were the only people in the world this was happening to. And to hear other people have been through the situation or in the same situation was like reassuring to us that there was a future. Anyway, it got round to the introductions and it got to my husband. And apart from when the children have been born, It's the only time I've seen my husband cry. He wasn't just
Oh,
crying, he was
Janice.
sobbing, but
Wow.
he was holding it all together and seeing it, weaving it and going to work. And I didn't realise how much it was hurting him with me doing all the mental and the physical stuff. So yeah, it was a big step forward. From
Wow.
that, we went to the court. We got the child arrangements order, but the child arrangements order only give us a third of parental responsibility. So still we were having to ask for decisions. It was hard work being on the child arrangements order, from what parents had right for and what we had right for, what decisions we could make. If they weren't in the right frame of mind, be it through drugs, be it through whatever, they could still come, and it depended which police officer you got of how they interpreted that, is how that situation was dealt with. And it was really, really hard going. From contacts, we were doing contact with one parent once a week, with one of the dads 3 times a week, with mum 4 times a week. Meanwhile, we still had to work. I'd had to give up my job as a transport manager, so that was a massive wage out of the family. I still kept 1 shift on a Saturday at Asda. My husband was working 50 hours a week. He'd have the boys on a Saturday, so I could do a shift in Asda. And then because Logan needed to be wrapped and bandaged and his skin needed to be treated constantly, I used to take my tea time at 6:30. My husband would come and meet me on the customer service desk. We'd go to the disabled toilets, and I'd have to do all his wraps, all his medicines, and everything. So my husband could go home and take him to bed and give him all his medicines, because he couldn't attend all the hospital appointments. It was only me, because he was keeping us afloat. He had to cash in half of his pension just to keep us afloat. And yeah, the demands on us were very high.
And that's a really common experience. We've got some stats on the costs and the finances in the annual report. Well, Janice, I have to say, thank you so much for giving your lived experience and bringing that vulnerability to help us learn in this space. I have to say, you turn that lived experience into strength, and you have infinite strength in yourself personally, in your family, but also in the way that you support other kinship carers. And Janice is a real mover and shaker and a national voice on kinship, and she's been able to support many hundreds and probably thousands of carers, would you say, Janice, through doing kinship?
Yeah, I've been through the Connected programme. But yeah, Tim, let me end on 4 years later, we won at the Ombudsman, and we found the local authority guilty. It was all upheld of sidestepping their responsibility. It was following a case in Southwark. We got that SGO, and the minute that SGO was signed with a full stop at the bottom, our lives changed for the better. The settlement within the family, the settlement in the roles that the parents, 2 fathers walked away, mum has contact as and when, but to get the SGO for us worked as a family, and all the trouble dispersed from the front door. It was amazing.
And that complexity, and I know that currently the Law Commission are looking at the legislation around kinship care because of the complexity. And Janice has mentioned the difference between a child arrangements order and a special guardianship order. There are also some kinship carers that are kinship foster carers, and as well as the legal status and the parental responsibility for the child changing, there's also usually a difference in the funding and the resources that a kinship carer has as well. So it's a changing picture in kinship, because the government also rolling out a financial allowances pilot to try and equalise the payments and for carers in different local authority areas. And so we're going to see how that pilot goes as well. We've got a few slides to give you a bit of national context. So this is the Handle with Care. So this is an annual survey we do every year, don't we, Janice, in kinship?
Totally do.
And
well supported as well.
That's right. This year, record numbers. So nearly 2,000 kinship carers filled it out, and that represents about 2,700 children in kinship care. So it's a significant survey, and it's a temperature check on where kinship care is at and where carers are at every year. And these are some key headlines from the survey for you. And I've got a bit more detail here actually. So and there's actually reason for optimism about kinship care and the direction of travel. On finances and cost of living, 40% of carers say that they're living comfortably or doing all right, and that's up from 30% in 2023. But still, 24% of kinship carers say they're finding it quite or very difficult to manage financially. 7% of kinship carers rely on food banks, 11% skip meals, 21% don't turn on the heating due to cost. So there's still significant economic disadvantages. And we heard from Janice about needing to give up work, and you're losing money, but also a part of your identity as well, I guess, Janice, when you've got a quality job like that you have to give up. Yeah.
Oh, totally, Tim. And it's 2 more mouths to feed, 2 more lots of nappies a week, 2 more lots of clothes, and still got 2 teenagers at home, and wanting to give one of my heartbreaking moments, and that's why we cashed in part of the pension, was my 12-year-old daughter, 13, who I believe are a big forgotten part of the whole kinship parcel, is those children at home. And even 10 years on, seeing her, but we couldn't afford to send her on a school trip to Germany. And it was like, I cried and cried, and my dad's like, why didn't you come to see us, and this, that and the other. We couldn't think of borrowing another penny, and that's why we had to cash in the pension. We were on our knees.
And that's a common experience, isn't it, for kinship carers up and down the country? Yes. Well, and, another interesting area and very relevant to us, in that we've been doing quite a lot of thinking about that family group decision making mandate, which is still moving through Parliament, as we understand it, and we're still waiting for the royal assent. But when that mandate comes in, one thing that is significant, that I think you put it really nicely, that we try and use that family group decision making earlier as possible, so that there's time. One thing that comes through so strongly from Janice's story, and from the stories like it from other kinship carers, is the lack of time. And it's like, and so if we can hold those family group decision making, if we can bring in extended family options as early as possible in the life of the problem, I think that is where family group decision making will work for kinship carers. We did hear through the annual survey that carers actually often felt that family group conferences, which is like, that's part of the umbrella, isn't it, of family group decision making, that family group conferences often kinship carers felt they weren't for them, that it was about parents, or they felt pressured to make quick decisions about taking on the care of their grandchildren or relatives. And so the other thing I think that where family group decision making could work really well for kinship carers, I'm just taking this question on because we've actually just been thinking about that this week, is in support planning afterwards. So building, helping to support the network around the kinship carer after the children or a child or children come to live with them. I think that's where family group decision making could work really well as well. So as well as that critical point of pre-proceedings, which is where the government mandate is, if it could be used earlier and used later, then I think that could be effective for kinship carers. Yeah, you're nodding, Janice, when I was saying that family group conferencing can be difficult for kinship carers.
Yeah, it's like you're under fire every single step of the way, and you only hear the negatives. It's not a positive experience because you're dealing with crisis all around you, and the focus is just on there. So I think taking the voices and the considerations into context when they go into conference is a massive thing of understanding before you get to conference, and explaining, you're not under fire. These have to be put out there, this is what we're hoping to achieve, you know, and things like that, because it can be absolutely horrendous.
Well, we're up against the time, aren't we, Nihal? And
Yes, we are.
I've totally spangled the slides and the timings. I'm really sorry about that. That's on me. But we thank you very much. It's been an excellent session. Thank you very much to Janice. We really appreciate you. With that's the email address for Kinship. You can contact me at tim.fisher at kinship.org.uk. I did drop into the chat as well. I've got a podcast called Messy Social Work, and the theme of the podcast this week was talking with children in kinship care and researching children in kinship care with Paul Shuttleworth, who is a researcher. And so do click through the link and check that out. But it's really lovely to have the opportunity to talk to you all. And I know you're out there supporting social workers and influencing practice in a real way in the different local authorities you're based. So it's really nice to be able to bring you these messages about kinship care. And we appreciate all the work that you're doing to support kinship carers in your local authority areas.